Hi everybody, Dr. Alfred Marquez with a topic that probably will put you to sleep. So this is talking about sleep position. Several weeks ago, we had a webinar with a group of doctors that I meet with, and we had a guest. His name is Lieutenant Colonel Philip Neal. He's a doctor. He's been instrumental in developing protocol that treats our soldiers in the military in treating sleep apnea. And it's real interesting where he's taken it. He's become really a great expert in this. And when I saw this, I said, what? I said, he's going to be talking about sleep position? I know how to sleep. All I do is lay down, close my eyes. But after listening to him, so much of what he said makes sense. So I'm going to go into this a little bit more detail. I would encourage you to listen to all of this, and hopefully it'll make a difference in what you do, and hopefully you'll sleep better, but don't sleep until I get done with this. So first of all, let's talk a little bit about this. How can sleep position affect the way that I sleep? Is that really possible? Well, if you look at people with sleep apnea, just sleeping on your side versus sleeping on your back will reduce and resolve sleep apnea probably in close to 20% of all patients, whether it's mild, moderate, or severe. So position can absolutely be critical. When we look at animals, a lot of animals, and guess what, we're animals, they can only achieve deep sleep if they lay on their sides. That's pretty interesting. Now, why would we not lay on our side? A lot of people say, well, I do well sleeping on my back. I'm looking at a person right now that just now told me that. And, but the thing is, well, let's think about it. What happens when you're on your back? There's a couple of things. Number one, you've got organs. Maybe if you're a pregnant woman, you have a baby. I mean, what pregnant woman sleeps on her back? Not many. They'll move on their side because the weight actually compresses your diaphragm. Your diaphragm has less room to expand. The other part of it is when you lay on your back, the spine is compressed against the bed and there's more limitation as to how much you can expand. So on your side, the organs are away from your diaphragm, your back, your spine is more free and able to expand, so you become more efficient in the way you breathe. That's one of the things that Dr. Neal was showing us. So in my mind, I'm thinking, when is the last time that you could say, wow, I woke up and I feel so energized because I have this great sleep, and you know what, that happens night after night after night. I think the opposite is true for many of us, where when we have that one good night's sleep, we go, wow, I wish I slept like this every day. And unfortunately, things change. There's a lot of things that come into play. But today we're going to talk about sleep position, because our goal is to keep you from waking up, from facing what we call micro-arousal. What's a micro-arousal? That's where the body says, you know what, something's not right, I'm gonna wake you up a little bit. Takes you out of sleep, you move, you turn, and boom, you're back to sleep again. But you do that several times and it interrupts your sleep. So when you think, going back to what I was saying about that good night's sleep, just think of when the last time you had that good night. It's sort of like I closed my eyes, then I opened my eyes, and wow, it was morning. I didn't remember anything. I didn't move, nothing happened. So let's talk about this. We're going to look at this little prop that I have here. Okay, so say hello to my little friend. This little mannequin is going to help me explain what I need to explain. Now, first of all, like I say, yeah, a lot of people are going to sleep on their back. So we're going to change that. We're going to recommend that you sleep either on your left side or your right side. Now, physiologically, there is probably a little more advantage in sleeping on your right side than on your left side. But left side sleeping is probably good if you suffer from GERD and acid reflux. So very similar in the way you position, whether it's the left or the right. Okay, we want you to avoid back sleeping. We want you to get off your back. So what we're gonna do, I'm gonna try and position my little buddy here, and we're gonna look at the bottom leg, whether we're sleeping on our left or our right side. Our bottom leg is going to be straight. If you notice, I actually have the foot hanging off the bed, okay? The leg is straight, the leg on top is actually going to be bent. Now you can slightly bend this leg if you want, but for the most part, this bottom leg is straight. There'll be pressure that you should feel on the front of your bottom leg thigh. Okay, so if you're turned over like this, there'll be more pressure here, and that's going to take the potential for you developing pain in the back. Okay, so that's one of the first things. The second thing is our positioning of pillows, and we're going to recommend using body pillows, and you can get these. They've got I think they're called maternity pillows, and really different types of pillows. You got to kind of look around and see what's available. You can reach out to us and we can point you in the right direction. But a body pillow is a good thing to use. The body pillow should help support the knee, the leg on top, so that it doesn't fall, because when it does fall, you will tend to have maybe hip problems or back problems. So this support is good. This pillow should come all the way up. One arm will be on top, one arm will be on the bottom, and I'll come back to the arms in just a bit. And now your head needs to be supported, but we don't want your head folded down like this. We need your head to be straight in line with the spine. And so what you do is you get a pillow and you're going to put it under your head to support it. The pillow itself will actually come up under your chin and keep your head from coming forward and down. Okay, so I'll go over a couple of other little things. If the pillow isn't big enough to support your head and make it straight, you might get the pillow and fold it in half, but you need to make sure to get that whole body straight, the spine straight. Keep the bottom leg straight for the most part. Now granted, you can fold a little. Keep this bottom leg supported. You might need an additional pillow to help support that leg so it doesn't go down, but you're making this as comfortable as is possible. Now, a couple of things, and let's go back so I can show you exactly what I'm talking about. Okay, so leaving our little buddy here alone, let me point out a couple of things. I mentioned that the upper leg will be slightly bent and it'll be supported. And we want it supported because we don't want our leg putting any torque on our back, putting any torque on our hip, cutting off circulation where we'll feel uncomfortable. Now, one of the things I really couldn't show you, I said, get a body pillow. You're gonna have one arm on top, one on the bottom, and actually the way we're gonna recommend that you do your arms is that your arms are up like in fighter's pose. Your arms are up with a pillow in between. Okay, again, you need that support, because if you don't have the support, muscles will get tense, your neck will get tense, and you'll lose some circulation, which is enough to cause an arousal while you're asleep. So I'll show you how to do this in just a bit. I mentioned the pillow, the head support. When you have the head support, you're going to put the pillow so that it supports and keeps your head in line with your spine. You don't want a pillow that's too big. You don't want one that's too small. You want to be as straight as possible. I mentioned also the body pillow coming up, and the body pillow will come up to your chin. And it'll just kind of hold your head up like this, cradled between your arms and supporting your neck so that you're not moving around and you're not moving down. But the pillow will not come up and cover your nose. The pillow will not come over and compress your nostrils either, because we want everything open. So those are just simple tricks. It's not something that you're just automatically going to do. I mentioned the hands. I said, bend your arms, you're on your side, and something else that Lieutenant Colonel Neal pointed out, he said, bring your hands together, and I'll tell you what the reason is for that, or put them together like this. You can go like this, or you can go like this, whatever feels comfortable to you, but keep your arms in front. This will keep you from turning, and this will keep you more comfortable throughout the night. Now, if this doesn't feel comfortable, well, maybe you do this. You want to go into the same position every time you're getting ready to go to sleep. And in this position, the only thing you're going to sleep, you're going to get your brain used to it, is that when I'm in this position is because I am going to sleep. I'm not getting my telephone and reading. I'm not getting a book and trying to read it. I'll do that before, but when I'm ready to sleep, I assume this position, and that's it, and that's all I do. Hands touching. You might rub your hands, and when you do this and you feel it and you rub your hands, you kind of get this kind of a warm, relaxing feeling. And that's one of the things that we do to babies. Skin to skin, you know, they feel it, it calms you, it soothes you. I'm looking at Stephen over here, he's going to sleep now. He's feeling pretty relaxed. But it's the skin and skin, and when you do this, it sort of starts cluing your brain in to, this is what I'm doing. I'm getting ready to go to sleep, and I'm going to go to sleep. So ideally, you're not going to be turning and tossing. You're not going to wake up because my back hurts, my shoulder hurts. I'll talk about the shoulder right now. I left that out. My knee hurts, my legs hurt. You're trying to eliminate as many pressure points and things that will disturb your sleep. Again, this is presented to us. It's not just hearsay, but you know, this is individuals in the military that work with people all the time, and they want their soldiers to be as comfortable as possible. One of the things he pointed out, if you ever go to triage in case of a military emergency, if they're not able to get to the patients right away, they don't lay them on their back. They turn them on their side because they know they're going to be able to keep them alive in those situations. I was going to mention one other thing. When you put the pillow under your head, you want to keep your head straight. You're on your side. You're more tilted towards a forward position because your leg is actually, the thigh of your bottom leg has to be supported by the bed, but your head is up and you're taking the weight off your shoulder. So when you're laying in this position, your shoulders should be able to move fairly freely without moving your whole body. Because if you lay down and you're putting weight on the shoulder, that'll tend to make you uncomfortable and possibly wake you up. So like anything else, this takes a little bit of doing, a little bit of practice, if you will. We'll have some this video, and I'll probably have some handouts too that I can give that'll elaborate on some of this stuff that we're doing now. Sleep position, is that all that's going to affect our sleep? Well, there's also what we call mindfulness. We have to learn to control our thoughts, our brains, so they're not racing around and not letting us sleep and not letting us fall asleep because we're thinking about all these other things. But that's another thing. Your breathing certainly comes into play. There's a lot of different things that we can do with breathing. Most of us think when we breathe, we go in, out, in, out. Well, that really isn't ideal breathing. We should breathe in, pause a couple of seconds, breathe out, pause a couple of seconds. And probably most of us don't do that. Another thing that probably most people do is that they breathe through their mouth when we should be breathing through our nose. Big difference in the physiology between nasal breathing and mouth breathing. Now, functionally, in other words, the way we're designed to breathe through our nose. Habitually, or what we get used to, we start getting used to breathing through our mouth, which also can affect the quality of sleep. So I hope this video is helpful. Ran a little bit long, but I think the information here is pretty important and crucial to a good night's sleep. Dr. Alfred Marcus, thank you.